Welcome, I'm Dr. Steve Blunt. I'm an interventional radiologist and I'd like to let you know what to expect during your procedure. A discogram is a procedure used to determine if the disc spaces in your spine are contributing to your neck or back pain. For this procedure, before it begins, you'll meet with your radiologist. You'll discuss the procedure and be asked to sign a consent form which states that you understand the procedure, the risk and the benefits, and you wish to proceed. The physician will ask you to describe your pain. It's important that you be very specific. You'll be asked, where do you hurt? Does your pain travel? Does it involve an extremity? Is it the front or the back of the extremity? How far down your arm or leg does the pain go? Can you rate your pain on a scale of 1 to 10 for severity? If you were to feel pain during the procedure, you'll be asked, is this like your typical pain? If you do feel your typical pain at any point in the procedure, it's important to tell your doctor at the time you feel the pain. For this procedure, you'll change into a gown. You'll be taken to the procedure room, an IV will be started. You'll be given an antibiotic solution to reduce the chance of infection. You'll be given a mild sedative to help you relax as we proceed. Your skin will be cleaned with betadine, an iodine-based soap that may feel cold against your skin. The skin will be numbed with an injection of lidocaine. This causes a temporary stinging or burning sensation. It doesn't last very long. Once your skin is thoroughly numb, the doctor will use an X-ray camera to guide the needle into place. Once the needle is sufficiently placed where we want it to be, we'll place a second needle. This will involve numbing the skin again. Usually more than one disc space is examined during the course of the procedure. When all of the needles have been placed, the doctor will stress the first disc space. We do this by injecting a small amount of contrast, and you may feel nothing. You'll be asked, though, if you feel pressure or pain. If you do, where do you feel this? Does it go down an extremity? How severe is this pain? And most importantly, you'll be asked, is this your typical pain? Once the questions have been asked and answered for this disc space, we'll progress to the next space. And again, inject a small amount of contrast. The questions will be asked again. Once all of the disc spaces have been stressed, the questions have been asked and answered, the needles will be removed and Band-Aids applied. You'll be taken to the CT scanner where we'll obtain high-resolution images of the disc spaces with the contrast present. After a period of short observation, you'll be ready to be discharged home. After the discogram is complete, you should rest at home for at least 8 hours, drink plenty of fluids, and resume your normal diet and medication schedule. It's important that you not engage in intense physical activity, including exercise, physical therapy, or heavy lifting for at least 48 hours after a discogram. And remember, you should not drive after having had sedation for the remainder of the day after the procedure. Complications related to discography are rare and include infection or bleeding. If you were to develop sudden weakness in your lower extremities, it would be an important reason to contact the office. Infection in a disc space may require long-term antibiotic therapy or even surgery. Before the procedure begins, you'll talk with your radiologist and they will be able to answer any questions that you may have. Our team is committed to providing you the highest level of service possible, and I thank you for allowing us to participate in your care today.